Hello, this is Nina Sitan. I came to the United States in 1982. I was a registered nurse. My nursing career lasted 16 years here in the United States. I worked for the majority of my career in an intensive care unit where most patients came in between life and death. It was a very stressful yet rewarding work that I have done, as I do really love helping people. I would like to say thank you to the good nurses and doctors out there who really wants to give true help to the sick patients so that they can go back to their normal health and enjoy living as usual. I work with all kinds of doctors, from open heart surgeons, cardiologists, gastroenterologists, obstetricians, family practitioners, and other doctors. When a patient came into our unit, they were either being transferred from a medical or surgical floor for the reason that their condition worsened and doctors would like them to be closely monitored. Or our patients directly came from the emergency room and needed intensive caring both from good nurses and doctors. Both ways, when a patient arrived in our unit, we immediately notified their doctor that their specific patient was admitted. The doctor will then come right away. The doctor will examine the patient with a stethoscope or other instruments to find out what was going on with the patient. The doctor will also ask nurses to do other actions like taking blood pressure, temperature, and other tests. The doctors will also order laboratory tests such as complete blood count, chemistry test, X-ray, and CAT scan for a more comprehensive examination. When the laboratory test results are gotten in, the doctors will sit down with the patients and families. The doctors will show them the normal versus abnormal results, and the results were written in black and white. The doctors then will explain the plan of treatment to the patients and to their families so that they know what is going on. In short, these doctors have tests to prove their diagnosis or what was wrong with the body of the patient. But there was only one kind of doctor I happened to work with that have no test and made their diagnosis based on their personal opinions, and these are the psychiatrists. The psychiatrist will only talk to the patients, no blood pressure test, none whatsoever. They will stay in the room for an hour or so, and the more the patients complain to these doctors of how they feel, these patients will be falsely labeled as mentally ill and then given more than usual drugs that are so harmful with lots of dangerous side effects. In short, psychiatrists have no foundation or basis on their diagnosis. They have no test whatsoever of any kind. It was purely personal opinion, not based on the science of medicine. It's like going to a fortune teller with no foundation for their evaluation. Instead, they tell you what is wrong with you, that you have mental problems. These psychiatrists, again, have no basis for their diagnosis, and so much dangerous mind-altering drugs are being given to their patients. These drugs are called mind-altering as they alter or change the pictures in the mind of people. I've seen patients go wild, confused, combative, violent, and destructive from those drugs. They even experience hallucinations, meaning they were seeing things that were not present. An example is that if you are talking to someone on psychiatric drugs and they're having hallucinations, they do not see you as a human being, but they see you as a monster that they have to do something like getting rid of you. That's when they become violent. As a result, the patients acted crazy, but only because of the effects of these psychiatric drugs. Otherwise, patients, just like you and me, act normal when they are not on psychiatric drugs. My question is, why do we allow these doctors to even practice? They should not be allowed to be drugging people as they have no proven test. It is not a valid science. I created this video because I care about you, your family, and everyone in the community, and especially to those children, over 20 million of them, who are being misdiagnosed to have mental illness and put on dangerous psychiatric drugs. That I believe it is right for me to speak up and give you the truth that psychiatrists have no test when they prescribe drugs. So if you are suffering from sadness or depression or sleeplessness or nervousness or anxiety or any of these symptoms that are being misdiagnosed as mental disorders, go to a real doctor who do not believe on psychiatric drugs. Have that real doctor run tests to find out what is happening with your body. You may just have hormonal imbalance, or your body just needed proper nutrition or supplements, or you just need to go out more and be around positive people, be more creative, and pursue your dreams. Because what I just mentioned to you, such as the sadness or depression, are not mental diseases. They are symptoms that something is going on inside your body and that there is nothing wrong with your mind. Again, I would like you to go to a real doctor and have them do tests and give you the results. If you need any help and you want to talk to someone you can trust or to give you the correct advice, contact me. I can always refer you to a lot of good people, and I will be more than happy to talk to you. This is Nina C. Tan.